Joining me now is Dan Jarvis. He's the MP for Barnsley Central and the Mayor of Sheffield City Region. And Dan Jarvis, would you be happy to see some primary school classes starting on the 1st of June in your area?
Well, only if it's safe to do so. And I agreed with what Rachel Rees said earlier on. It's for the government to ensure that there is that confidence and that parents, teaching staff, teaching unions all have the confidence that sending kids back to school is the right thing to do. So I think the government needs to provide that assurance before people can have the confidence to let their kids go back to school.
Well, what are the safety concerns specifically that you have?
As a parent and as an MP and as a mayor, of course, I want to satisfy myself that school is going to be a safe environment for children and for teachers. We've been discussing earlier on in the programme some of the specific challenges that we have in the north of England, and the R rate is higher in the northwest and the northeast and in Yorkshire. Hospital admissions are higher than in other parts of the country as well. So we have some specific challenges here, and whilst obviously we want to get the economy ticking over as much as we possibly can, in the end, safety has to come first. So when it comes to children, when it comes to the school environment, of course, it's in everybody's interest to get the schools open and running, but only when it's safe to do so.
Yeah, but I understand that, but it's implicit in what the government's saying that they do think it's safe. Otherwise, they wouldn't want to reopen the limited classes in primary schools in this way. And if people are saying it's not safe, surely we need to know specifically what the tests are that they're applying to back that up.
Indeed, I think that's a fair point, and that's an ongoing conversation that's taking place between schools and local authorities, the teaching unions and national government. But I think it's not unreasonable for parents and teachers to want to be absolutely satisfied that the environment of a school is as safe as it possibly can be. When those assurances are in place, and it doesn't appear that they are at the moment, then I think it's absolutely right that school returns, but where it is safe to do so. We've got to take some quite difficult decisions about how we return to normal life. We've got to get our economy working. We've got to get people back into the workplace. But the guiding principle in all of this is ensuring the safety of people, both in the workplace, both in the school environment, but also in terms of getting there. Public transport, we've got to make sure that that is a safe place for people to be, because what we must avoid at all costs is a significant increase in the R rate, the rate of reinfection. And what we need to absolutely work to avoid is some kind of further spike or a second peak in the virus. That has got to be the priority.
But, I mean, we do have examples in other countries which have reopened primary schools, and we also know about the incidence of coronavirus amongst children. And frankly, the problems appear to be quite low. So doing this in this very cautious way surely is the way to go ahead, accepting what you say about needing to get back to some sort of functioning normality.
Well, I think when you're talking about the safety of children, caution is the right approach. And I think there's a balance to be struck, as I say, between seeking to manage the unlockdown and as quickly as possible returning to some sense of normality. We've got to get the economy ticking over. It is a massive economic challenge, and the sooner we can get people back into work, the better. But it's got to be done in a safe way. We've got to have workplaces that are safe, public transport systems that are safe, because the public have to have confidence that they can safely go about their business. I think we do need to be cautious in the way that we approach it, but we've got to make sure that all of the necessary precautions have been put in place and people can send their kids back to school with a real degree of confidence that they're going to be safe. I think that's not unreasonable.
More broadly, we are beginning to see clear evidence that the incidence of the outbreak is various around the country. Would you be in favour of different parts of England moving at different speeds?
No, I wouldn't be in favour of that. I work very closely with all of the other metro mayors, and collectively we are of one voice on this. As a country, we came into the lockdown together, and I think as a country we should come out of it together. That said, I think it's incredibly important that metro mayors and local authorities, city leaders, have the data they need to make informed decisions about how they can manage the unlockdown in the most effective way. So we didn't previously have the data for the R rate at a regional level. We've got that now, and that's useful. What we need is a greater granularity of those figures so that mayors, city leaders can make informed decisions, so that we can ensure that where there are particular hotspots, where there are specific areas of concerns, that they are being targeted and all of the relevant precautions are being taken to make sure that we stay on top of the virus. I think we do need to be mindful of the fact that there are a number of factors why we have some significant challenges here in the north of England. Underlying health inequalities is undoubtedly a factor, as is deprivation. I think it is deeply concerning that the rate of mortality is twice that amongst those from more deprived communities than it is from more affluent communities. I think that raises some big questions for the longer term, because what we don't want to go back to is the pre-COVID status quo, where we tolerated these very significant health inequalities. That will require investment and support by government, but we need to draw out some lessons and some good from this terrible situation that we found ourselves in.
But I mean, isn't there a bit of a contradiction there? Because once you start concentrating on hotspots and trying to sort out problems there, you are treating different parts of the country different. So if you're doing that once we're out of lockdown, why can't you actually do it in the process of getting out of lockdown?
I think the point I'm making is about targeting resource and ensuring that local authorities who've had their budgets massively cut over the past 10 years have got the resources they need to support those more elderly and vulnerable members of the community. I think that is the right way to proceed. What I think would be largely unenforceable is to seek to have different arrangements in different parts of the country. So a different arrangement in Manchester as opposed to Sheffield would be unenforceable, I think. So as much as possible, I think we need to proceed together as a country, but I think it is also right to look at some of the challenges in individual localities and look at how the NHS, the local authorities in those areas can be better supported to ensure that they've got the resources to provide the care and the support that's obviously required in some of our communities here in the north of England.
OK, thank you very much indeed, Dan Jarvis there.